Hello everyone, welcome to the Voice of Nursing. My name is Adrian Tracy, I'm the CEO of ICG. Today we're very, very lucky to be joined by Professor Charlotte McArdle, the Chief Nursing Officer of the Northern Ireland.
Mm-hmm.
Charlotte, welcome to the Voice of Nursing.
Thank you. Good morning.
Thank you for being with us.
Mm-hmm.
It'd be great just to start with the interview, Charlotte, maybe talking a bit about your background, how you got into nursing. I know we spoke earlier and I love that you still refer to yourself as a nurse, which is fantastic. Just understand how you entered the nursing world, why, and then maybe go a little bit from there.
Okay, well thanks for the opportunity to talk about nursing, and particularly nursing in Northern Ireland and my own career. Obviously I've had a very good career in nursing. It's been very good to me, and I hope I've been very good to it too. But I always wanted to be a nurse. The only thing I ever considered was being a geography teacher, and I've got absolutely no idea why. I always wanted to be a nurse, and my mum would tell stories about me being very young and trying to inject dolls and things. There's no nurses in my family, so I have no idea where that came from, but it's all I ever wanted to be. So I started my nurse training in Dublin in 1988, and obviously then qualified in 1991. And at that time, nursing wasn't a degree programme. You went to a hospital and you trained as part of that hospital, and you worked as part of the staff, and then you had time out in what we called blocks to do your learning and development, and then you had house exams and at the end, and you registered with the regulating body. So that all happened in 1991. I became a registered nurse, and then I moved to Belfast, to Musgrave Park Hospital, where I worked for about 6 or 7 years in rheumatology, which is quite specialised actually for a new nurse to be coming into that field. And I worked quite a lot with people with long-term conditions in rheumatology and also children. And I was lucky enough to be promoted during my time there from what was then a D grade staff nurse to an E grade staff nurse, and then to a deputy sister's post. And during my time there, I also undertook my degree, because as I said, as part of my training you didn't get a BSc honours degree, which thankfully is now the case, and I think that's a very welcome move, that all our nurses are degree nurses now. So I completed my degree programme, and I also had the opportunity. I think that early experience really shaped my thinking as a nurse and my value base as a nurse, particularly in relation to person-centred care and individualised care, and working with individuals and shaping your care around their needs. And I was very lucky to have opportunities there to be creative and innovative, supported by a good ward sister, which I think is really important for new nurses. So in 1998 I worked at an acute medical ward, which I was responsible for, and during my time there I became heavily involved in practice development, and the ward that I was responsible for had some difficulties at the time that I arrived there. So I used practice development and working with staff and their beliefs and values and team building and leadership skills and all of that to change the culture of the ward and improve the care that was there. And I also undertook my master's degree while I was a ward sister, full time.
Plenty of spare time then.
Yeah. And at that stage, my oldest daughter, who's now 21, or my only daughter, who's now 21, she was born in 1996, so she would have been about 2 or 3 when I was doing my master's. But we got through it anyway, and my research was around person-centred practice and the role of the ward sister in that. And having completed that, then I naively thought that I could be a nurse manager, and instead of having 1 ward, have 11 wards to look after, and thought that I could do what I did in my 1 ward with the 11 wards, only to discover that it doesn't really work like that. There were other people who have other priorities and other views and have different opinions on things. So being able to take on practice development across 11 wards or a whole directorate was extremely difficult, but nevertheless, made progress, and we were able to small steps.
Give us some of the examples of the challenges you faced. How you overcame.
Well, I think that there's a culture in any big organisation of this is the way we do things, and we've always done it that way, so we'll continue to do it that way. And many of the challenges that I saw were about wrapping care around people's needs and not so much around staff needs. So, there were rotas in place, and rotas were developed around the needs of the staff, which is important. I'm not taking away from that in any way, but it can't be at the expense of how care is provided, and we need to have the right people on duty at the right times. And while I'd be very flexible in terms of people's family commitments, our priority is to provide a service to patients. So engaging with staff around how we could change the rota, which would provide more continuity. So if you were a patient in my ward, that I would say to you, hello, I'm Charlotte and I'm your nurse, and I'm going to be here for the next 3 days. So you will see me over the next 3 days. So if you're family or you have any questions or queries or things, you come to me. But in the way in which our rotas sometimes are set up, that continuity is not there. And you might have a nurse who's working today but then off tomorrow and then on night duty, or works for 12 hours a day 3 days of the week and then is not there for 4 days. So trying to overcome those kinds of challenges were for some difficulty. And then how we arranged care and how we allocated teams of nurses was all reviewed, which meant that people then worked with a group of patients, where in the old model of task-focused care, the senior nurse would have done the ward round, she would have done the medicine round, but now I'm saying, no, if you're the nurse who's responsible for that patient's care, you do everything for that patient. So you talk to the consultant when he comes into the ward round, or she, you do the meds because you know how those medications are impacting on that person's care. You provide the holistic care for that patient because you are the person who has the most information and should be the point of contact. So that meant the whole organisation of nursing work had to be re-looked at. And they are big challenges because they are affecting how you think and work, and the culture of the organisation and the culture of the wards. And every ward has a different culture, and that culture is very much set from the ward sister. So for me, a key post in the whole health service are ward sisters. They're the pinnacle of most people's clinical careers, and it should be something that every nurse aspires to. But we have modified and changed that role significantly over the years. Some good changes and some not so good changes.
And then you went from there after managing that, moving to the primary care market?
Well, no, I moved then from being a nurse manager to the deputy director of nursing in the Royal Hospitals. And then there was a reorganisation in the health system in Northern Ireland, and we moved from 18 trusts to 5. And as part of that reorganisation, which happened in 2007, I became director of nursing then in the South Eastern Trust, which all our trusts, 5 trusts in Northern Ireland, are integrated health and social care trusts. So we work alongside the social care model, and the social work staff and the social care staff are employed in the main by the trust, which I know is different from other parts of the UK.
That's quite an evolutionary model, isn't it? I mean, that's a lot of people. I know it's one of the big things in Ireland. The NHS Confederation. He talks about getting that budget together and doing that full range all the way through.
Well, we have it. Yeah. We've had it for a very, very long time. It's always been that way, back since the 1970s in Northern Ireland. So as director of one of those organisations, I had professional responsibility for all the nursing and midwifery staff, which was about 3,500. But within my directorate, as a director with responsibility for primary care, older people and community nursing, I had responsibility for about 5,000 staff, which included all the social care staff, and I had a budget of 135 million. And the total budget of that organisation would be 500 million, and it would serve a population of about 350,000. So it's a fairly big organisation, and I had the opportunity probably to lead that and shape that organisation from the start in 2007 when it was established, and I stayed there right up until I went into this post that I'm currently in as the chief nurse in 2013.
You moved sort of from that clinical area to the managerial and did a lot of leadership around that. How do you learn that? Or was it a learned thing? Was it a trained thing? Because a lot of nurses sometimes move into managerial roles, but they aren't actually trained from a managerial point.
Yeah.
It's really interesting to listen to how people shape that.
Well, I think that as a nurse, you're a manager from you qualify, really. I mean, you've responsibility for delegating care to support staff or nursing assistants, and then as you progress, to a senior staff nurse, you're in charge of the ward. To a sister or deputy sister, you've got total responsibility then for the ward, not just the staff and the rota, but also the budget and the standard of care, the multidisciplinary team. And so you're building your managerial skills, and at that point your leadership skills as well. And I mean, I've had some leadership development, absolutely, and would welcome that, and would be keen to take the opportunities that present themselves. But for me, I think a career in nursing probably gives you more flexibility in those roles, because, as I say, you're developing those skills right from undergraduate in terms of management and leadership, and you're building on it incrementally as you become more experienced and more confident in the care that you provide. But leadership for me is about beliefs and values, and particularly your values, and then behaviour that reflects those values. And I think sometimes that's where people they don't add up sometimes, where a value system says one thing but the behaviour doesn't demonstrate that. So I've always tried to be very, very open and honest about those things and live my values through my behaviour. Nobody's perfect, and I'm sure I get it wrong, and I'm sure if you talk to people they will tell you that, but in the main that's what I try and do. And I think people would say generally about me that I am person-centred, and I always try to think about the person who's receiving care, and that's why I like to stay close to what's happening in practice, because that informs your ability to make good decisions, and it also keeps you very grounded. Particularly when you move into leadership roles, it is important that you stay very close to that, and that you are out and talking to people and learning from their experience. I went back to practice last year for a few days, and I found it incredibly challenging. I loved it, and I loved being there, but I couldn't do that role now permanently. I could be retrained, but I was working in wards and the emergency department with patients, and having to relearn some of the skills that I'd lost. But I understand the complexities and the challenges and the tensions that a Band 5 nurse has on a daily basis when they're trying to provide that care. So that's what I mean about keeping it grounded and keeping it real, and to be authentic about those issues and open about what they are.
So it'd be really interesting to understand Chief Nursing Officer. What does that mean? What does that cover? What does the role encompass? You're talking about getting on the front line, which I think is fantastic. It's great leadership. It'd be really just interested to hear a little bit about the scope of the role.
Yeah, well, I suppose I work now for the government. I provide professional advice to ministers and senior departmental colleagues, both in the Department of Health and across government, on issues that relate to nursing and midwifery and allied health professions and their practice. So that's my primary function is to provide advice to the Minister and support the Department of Health in terms of making good policy decisions, and obviously policy decisions that are implementable and practical for staff and reflect the needs of our population, which is obviously changing. And so keeping policy which is contemporary and future forward-looking with a future focus, because that's one of the jobs of a leader, regardless of your role, I think, is to be horizon scanning and thinking about the next 10 years as opposed to in the moment. And that's my primary role. I also set standards for practice in Northern Ireland and make sure that those standards are adhered to. And I have policy responsibilities which the Department of Health have given me as the Chief Nurse in relation to areas of care like patient experience, partnership working, co-production, which is very much now part of our transformational model of care, focused on improvement and working very much in partnership with the people who use our services, but also the community and citizens and the population and what we would need from our health service in the future. and how would I engage with you as a citizen of Northern Ireland to understand what that means for you in the future and what's important to you in that scenario. So I lead on all of that, and nutrition, and I suppose policies that are aligned to my field of nursing and midwifery. I have a very strong leadership role for the profession as the most senior nursing role in the country, and I do that with colleagues, and we work and learn from each other. Northern Ireland is small, so there's a small team of senior nurses who help inform those decisions. So I'm not the only person informing the Minister and the department. It comes from a network of people that I have who advise and support me in that role.
In regards to nurses themselves, what do you see in Northern Ireland specifically, the kind of biggest challenges that we're facing at the moment?
I think the big challenges for us are primarily around, we have particular challenges in Northern Ireland around our assembly at the moment, and the fact that it's not functional. It hasn't been for 21 months, but I've no doubt that will be rectified at a point in time. So, and that has given us a particular set of challenges which we will deal with whenever the assembly is back up. But in the main, I suppose the big issues for us are around the population, and we have a growing population, but the growth in the population, as with most Western European countries, is in the older age population, and that's to be welcomed. You know, that's a result of good science, good care, new technologies, advances in medical practice and healthcare practice. So that's all to be welcomed. But it also does provide us with some challenges about how we enable those people, which will be us in the future, to live well and healthy, and to maintain and look after their own health. And so our system and the provision of health and social care needs to keep abreast of that and change and morph into a system that can facilitate that. Because if we stay in the model which we're currently working in, which is still pretty reactive and disease focused, we will never be able to provide the level of care that's needed within the current funding envelope. And even if the funding envelope changed, you know, it's never going to keep a pace with the demand for service. And one of the key focuses of providing health and social care is that transformation that's required to shift us from a reactive system, which kind of interacts with people when they become ill, to a proactive system that engages with citizens about keeping well in the first place.
It's more preventative care to stop people.
Essentially. Preventative care, well-being, but also ownership for your own health, understanding what that means to you, what's important to you, how you might achieve that, how we ensure that our children get the best start in life, and because we know that childhood experiences has a huge effect on your health and well-being thereafter, and we know that children who've had more than 4 poor childhood experiences, like domestic violence or abuse or lost a parent, those kinds of things, we know more than 4 of those has a really adverse effect on children in the future. So I think it is important that as a society we look after our children and make sure that they're the future, that they have the best start in life. So a lot of the work we need to do is in that preventative space, and then obviously with our diet and the way in which we work, technology, we are we're more socially mobile but physically mobile. You know, we're doing less exercise and we're eating more convenience food. And many of us I don't smoke, but many people are still smoking. Alcohol, drugs, all of those things that collectively have an adverse outcome on your health as you grow older. And so we're seeing huge challenges in things like type 2 diabetes, which is preventable for the most part, if we take control of that. And it's those kinds of conversations and the education of the population around understanding what that means for them as an individual and what the outcome's likely to be on their life. They're the kinds of conversations that we need to get much better at. And so the provision of healthcare and the role of nursing, which I think is well placed to lead some of those discussions becomes much more about a facilitator and facilitating people to make their own decisions about their health rather than just delivering care.
And what does that look like for a nurse on the front line at the moment? There are a lot of pressure, probably more than ever before.
Yeah, it's extremely difficult, very, very challenging, obviously. But within that, there are small opportunities, 30-second opportunities to begin a conversation when the person's ready. There isn't any point if the person's not thinking about, how am I going to stop myself from having another heart attack? If you're not thinking, okay, I really want to do this, because life changes are difficult. But there are small moments in that process where the nurse could just begin that conversation or point that person in the right direction, or talk to a family member. So I believe it's everybody's role, and that we should all maximise those moments for a conversation. But I absolutely accept that that's very, very challenging in the situation we're in at the moment.
And nurses themselves, I think it's come up a couple of times. Nurses aren't very great looking after themselves.
No.
Pressure and the mental health point of view, they're great, patient focused.
Yeah.
If there's anything we're doing in Northern Ireland in regards to mental health, the pressure they're under, is there opportunities for them to be looked after, if nothing else?
Yeah, well, I think there are opportunities. I mean, our employing organisations, some have been very creative about health and wellbeing apps. About early identification of risk factors, about providing support for their staff. And again, it's back to what we're saying about, in the acute setting, ward sisters, they have that role where they can coach their staff and talk with them and understand their difficulties. But we need to allow the ward leaders the time to undertake that role. Health and wellbeing apps, healthy meals is another initiative. Nurses work, because of the nature in which they work, unsocial hours, long hours, up all night. Providing healthy snacks it is difficult and challenging, but we do need to look after our own health and take responsibility for that. And I was glad to see there was reference made to that in the NMC's code about our responsibility to look after our own health. Most organisations will have access to a wellbeing service for over-the-phone support, and Inspire, one of our mental health charities, actually provides that service for many of the organisations. Other activities are happening in organisations like physical exercise, boxercise or yoga, or for the guys it's five-a-side football, and happens after work, immediately after work. So it's about providing much more of those opportunities, I think. And
you take quite a hands-on role with that. I know you do a bit of some work with the RCN Foundation.
Yeah, I do. I'm a trustee with the RCN Foundation, and obviously primarily they provide help and support to nurses, either through professional development or grants to undertake education training or development of practice, but also in terms of hardship funds for those nurses who find themselves in extremely challenging situations. And that sort of just interim time where they need a little bit more support or pointed in another direction in order to assist and keep them emotionally stable during what sometimes can be a very difficult time.
And also, difficult to be doing two jobs at the same time.
Yeah, absolutely.
Trying to improve as well. And I know we spoke off camera, we were talking about NIPEC, which might be quite interesting for you guys to understand what that means, what it is.
NIPEC is the Northern Ireland Practice Education Council, and it's a very small organisation that punches well above its weight in terms of its contribution to the health and social care system. And primarily, the NIPEC team work with me, and they're an arm's length body of the department, so that means they have a sponsorship, and I'm their sponsor from the department's perspective. So I work very closely with NIPEC, and mainly what they do is to translate policy decisions into practice. So they help convert, in that conversion of policy making into practice. What does it mean to implement that policy? And they work with the 5 trusts and the independent sector and primary care to do that. So we've been doing a lot of work in NIPEC around career pathways. So trying to put together a career pathway for nursing that demonstrates the different routes that you can take, because there are huge opportunities in nursing. It's a very diverse profession, and there are huge opportunities to stay in clinical practice, to go into leadership management, or to go into research or education. And so we've tried to define those pathways a bit more, and use stories of people in those roles. So there are some podcasts available on the website. And we've also done work around advanced nursing practice, so we now have a pathway for that. We've defined what that means, and as a result of all of that, being able to shape that, we've now undertaken commissioning a programme from Ulster University around advanced practice, and last year was the first time that we ran the programme, and we ran it specifically for emergency care nurses and primary care nurses, and the feedback has been amazing. Everybody is enjoying it. They're working really at the top end of their licence and making a huge difference in terms of supporting the multidisciplinary team in challenging areas. Both primary care and EDs are very pressurised areas.
I think it's really interesting the point you make about the different career opportunities there are now for nursing. You know, obviously some nurses go away and have a family, then come back, but obviously you onto that pathway through to the chief nursing officer, some go through the clinical route. Depends which your vocation is.
Yeah, well, I mean it does, and I think we have to role model and showcase those opportunities with positive experience for people. The last one I saw was one in relation to learning disability nursing. And learning disability nursing is a small specialty, but makes a huge contribution to health outcomes for people who are very disadvantaged because of their learning disability. And we know that their life is 20 years shorter than most of the general population. So the learning disability nurse has a key role to play in maximising health outcomes, but working in a very social care context, and unique opportunities in that model. So understanding what those opportunities are, and releasing that value through learning disability nursing is important. And what we notice, and I'm sure it's the same in other countries, a significant number of our nursing students are now mature students, and they're people who've already undertaken their first degree. And they're maybe in their, I don't want to stereotype anyone, but maybe in their mid to late 20s or early 30s, they have their own family, they've decided they want to do something different with their life, they've already got a degree, and so they go back, but they often tend to go back into fields like mental health or learning disability, where they want to work with people who have vulnerable behaviours, vulnerable situations, difficult life experience, complexity, and because they really want to make a difference. And that's one of the benefits about nursing, is it provides you those opportunities to really make a difference, and to go home at the end of the day feeling that you've just done one small thing that has actually had an impact on somebody's life.
A bit of a broad question, but what do you see the sort of future looking like for the role of a nurse?
I think the future is very bright, actually, and I mean we could get bogged down in the challenges, and I again don't want to underplay those in any way, but we will get over the challenges, and we will eventually have a much more stable workforce, and that's probably not that far away realistically. But there are huge opportunities for nursing to shape the transformational journey and to improve the outcomes of care and improve the health outcomes for the population that they serve. And now's the time, I suppose, to step up and lead that change. And I think nursing is well placed to do it, because it is the profession that spans all areas of practice. Right across from cradle to grave, acute community, right out into the areas that sometimes we describe people as hard to reach, but we need to make it easier to reach. And many of our nurses, like our health visitors in particular, are out working with and dealing with those families. So it stretches across all four corners of the health service nursing, and provides care in hours and out of hours. So I think it's well placed to lead and to shape the future of health and social care. And I believe that because of the type of undergraduate programme we have, and the fact that we do have degree nurses, they are well placed in terms of their education and their training and their ability to use evidence-based practice and to facilitate and coach people in the future to be able to do that. So I think there are huge opportunities. in terms of prevention and health promotion and population health, but there are also huge opportunities in developing new roles, exciting new roles, and working. I always refer to our nurses working at the top end of their practice or their licence, and we're seeing more and more opportunities in developing more and more new roles that create those opportunities. Like the advanced nurse practitioner role that I spoke about in primary care. So those nurses are about halfway through the programme, the first cohort. They're already running their own clinics alongside their GP colleagues. Patients are not being triaged. They're seeing the next person who comes to the GP surgery in the same way that the GP is
we also
already.
Some nurses doing surgeries and things like that. Surgical nurses doing exactly the same role as the doctors.
Yeah, and they're going out to the nursing homes, and they're reaching to those nursing homes on behalf of the primary care team. But in some ways the nurses are better placed to do that than the GP, because again they're focused on a holistic model, and they maybe have a little bit more time. And what that means is that we allow our GPs then to do what our GPs do really well, and we allow our nurses to do what our nurses do really well, and everybody's happy. It's a win-win for everyone.
You mentioned new roles. I know there's a role that's kind of come up, a lot of people discussed about the nursing associate role.
Yeah, we don't have nursing associates in Northern Ireland. The regulations in relation to that with the NMC are England only. But what I would say is we have very good career pathways for our nursing support staff and social care support staff to go into whatever career they choose, but I'm obviously talking about nursing. So we have a programme with the Open University, which is really successful, where our nursing support staff can undertake their degree in maybe a slightly different way, given that most of them, for whatever reason, have chosen not to do the normal academic route, or haven't had the opportunity, or are more mature, or whatever. So there's a more flexible approach to do that. They're enabled to study part-time at the university and work part-time. They have supervisors in practice to develop their clinical skills, and it's a very, very successful programme. We started off with 25 a couple of years ago, and now we're putting through over 100 students a year, and there's a waiting list every year. I'm always surprised, because I think eventually we're going to run out of support staff who want to do this, but there's a waiting list and it's growing. And the thing about it is those staff who are provided with that opportunity are very loyal to their organisation, so they want to go back to the organisation and work as staff nurses, and they're very committed to that. And it's lovely to see those students now progress into senior charge nurse roles or sister roles, and we have a couple of those in the system already, and we run the programme for adult, general and mental health, and they're both very successful.
Sounds great, the amount of support you're giving the nurses over in Northern Ireland.
Yeah.
I suppose it'd be interesting to hear about the opportunity in Northern Ireland for maybe international nurses, because this is going out into the UK, but it's going out to the US and America, also Australia. We also do some stuff in India, the Philippines, and I know we've spoken about. It'd be interesting to understand, if someone was international thinking about Northern Ireland as an option.
Well, I mean, Northern Ireland is unique. There's no other way to describe Northern Ireland. It is unique. It's small, as I've said. It's a very vibrant place. The largest city, which is Belfast, is totally changed over the last 10 years. It's vibrant. There's lots of nice places to go, to eat. It's a small city. It's easy to get around. The cost of living in Northern Ireland is a little bit less than it is in other parts of the UK. It's well connected, both to the south of Ireland, to Dublin, and then to Europe, either through Dublin or London. It has places of outstanding natural beauty, like the Giant's Causeway. It's easy to get from one part of it to the other. We have a lovely climate. Everything's always very green. And it's a very nice place to live and work. And the one thing that you can be assured of, if you're either a Northern Ireland or Irish nurse who wants to come home, or an international nurse who's looking for a different experience, is that you'll be very welcome. And there will be a lot of support put in place to help you make that transition. and there are great opportunities in Northern Ireland to develop your career, many of which are paid for through what we call the Education Commission budget, which I have, to commission courses for postgraduate nurses. So all of our specialist practice qualifications, district nursing, palliative care, intensive care, whatever, advanced practice, practice development, leadership opportunities, many of those opportunities are provided free. And also in some cases are paid for by the employer to allow you the time out to do that. Now, that's difficult in the current climate, but we've maintained a budget to do that, and that will continue as part of our transformation. So we're growing the numbers of district nurses and health visitors incrementally, and we're growing the opportunities for nurses to do advanced practice and take on specialist practice pathways, because we see nurses at the front of the transformation programme, and so we have to put that support in place. So there are really big opportunities there. And three very good quality universities through the OU, the Ulster University and Queen's University based in Belfast.
When you spoke to earlier, we were talking about international nurses coming over to Northern Ireland, about the support framework you've got around the OSCE. So this year we have been recruiting nurses, international nurses, most from outside of the EU, and the majority of which are coming from the Philippines and India at the moment. But what's unique to Northern Ireland is that when you arrive, you will be supported with an education programme that will facilitate you getting your OSCE exam. And we have an in-service provider called the Clinical Education Centre, which has set up a mock OSCE centre, and they will support you right through the OSCE process. And with that in mind, we've had a 100% success rate at our OSCE programme. And we also have an OSCE centre in Northern Ireland, which means you don't have to travel to England to undertake that. It's an accredited centre by the NMC. So it's a very positive experience for those international nurses that have come to Northern Ireland, and there's a long history of international recruitment in Northern Ireland. I myself recruited people from the Philippines in the early 2000s, and many of those nurses are still with us and set up family, home, life, and have taken opportunities to develop their career. And they're very interesting people to talk to and understand their experience, but in the main they would all say they have found the support that's been wrapped around them been invaluable in making that transition, and I'm not sure that is actually the same in other parts of the world. And how are you, or how's Northern Ireland? I know you've spoken about A&E, which I know you're quite passionate about the winter pressures and coming up. How's that looking from that point of view?
It's challenging. It will remain challenging. It's challenging because the service, the model needs to change. As we talked about earlier, transformation, that's going to take a bit of time, and we're in this transition period between moving from the old and trying to get to the new. There's an increase in the demand for the service, particularly in the older people's long-term condition presenting at ED. And we have workforce challenges the same as everybody else across all our professions, mainly nursing and medical. But to, I think, our credit, we have increased the numbers in training. We've almost doubled the numbers of nurse training places available. They still get their bursary and their fees paid. We have a very dynamic and exciting postgraduate programme. Again, as I've said, much of that is funded. We've provided opportunities like the Open University to grow our own and provide people who maybe haven't had the life opportunities in the past to do that now. We've returned to practice programmes. We have good leadership programmes. There's a huge focus on quality improvement. And every organisation has a quality improvement plan and ethos and focus, and nursing is very much part of that. So I think that we have a workforce strategy as part of our transformation programme, which values and recognises the contribution that staff make, and the emphasis on that is about providing a better staff experience, because the evidence says that when you look after your staff, they will then look after the clients and the patients. But if the staff don't feel looked after or cared for, it's very, very difficult to go into a challenging environment day after day and give 100% of yourself. So the whole focus of our workforce strategy is about valuing our staff and listening and hearing to what they have to say. So I think give ourselves some credit in Northern Ireland. We're very aware of the workforce challenges, but taking as much action as we can to sort that out. But it's not going to happen tomorrow. This winter will be challenging. Next winter most likely will be challenging. It is going to take a couple of years to start to see the improvements.
Is it good to hear that it sounds like Northern Ireland's got a short-term and a long-term plan there?
Yeah.
You understand about the training, bursaries,
yes,
and there is a plan there to
yes.
create your own, if you like, and also look at the international opportunities,
yes.
and look at different pools of people coming back to work, people who've never had the opportunity. I know you've spoken about kind of times.
Yeah. I mean, I think that we have to grow our own nurses. Every country has to grow their own nurses. There's a worldwide shortage of nurses, so we can't overly rely on international recruitment. It was only ever intended to be an interim measure between getting us from a shortage of nurses to having a cadre of our own nurses fit for practice and ready to practice. So, we've taken the opportunities to encourage international recruitment, to entice people to come. If they want to come for a while and move on, that's fine. If they want to come and stay, that's also great. We can work with that. There's room for everybody in our society, and we would welcome the diversity of a nursing workforce that brings different skills and life experience. And I'm keen, and we're keen to promote the opportunities that nursing has for everybody. It shouldn't be exclusive to people who can find their way through a process or attain the right level of educational qualifications, although that is important, but that route is not for everybody, and we need to recognise and support diversity.
Very good. You're obviously very busy.
Yeah.
Tell us a little bit about, you must have some downtime at some stage. What do you do outside of work?
Well, I'm busy. I mean, I'm a mum. I have 2 children, one of which is now an adult, and a teenage son, and a husband. So they all, and an extended family, a mum who lives in Dublin on her own. So I visit her a fair bit, and I mean, life work balance is important, but it's all consuming, really. I like sport. I used to coach girls football in the past. I've had to stop that because of just busyness of life and work at the moment. But
who's your team?
I don't have to say. Chelsea.
Okay,
yeah, we all support Chelsea, and we would be regular visits to Stamford Bridge.
A lot of nurses happy, a lot of nurses sad. We'll find that.
Yeah, no, yeah, you can't please everybody all the time. Sure, you can't. And I like to try and keep reasonably fit. Do the park run, 5k on Saturday morning. Started circuits last week. Feeling very sore at the moment, but just like to role model. I don't want to talk to nurses about keeping well. For me, not to be leading from the front, as they say. So I think that's important in terms of your credibility and your authenticity.
Very good. And where can we find you on Twitter and Instagram?
I'm on Twitter at Charlotte McArdle without the E at the end because it won't all fit. But if you go on, there's not that many Charlottes, so you'll find it easy enough. We'll add it at the bottom of the bio. Yeah.
Charlotte, thank you so much for your time today. We really appreciate you coming over. Thank you for watching The Voice of Nursing. Thank you to all our nurses, healthcare visitors, and doctors out there for looking after us all. We look forward to catching up with you soon. Thank you.